The right brachial chain is an explanation and a concept founded by Postural Restoration Institute that is the upper half of this whole left AIC pattern. I have a video I did last month on the left AIC, which I will be linking below. This is an important concept to understand because we can't separate the pelvis from the upper body, and we can't separate the upper body from the pelvis and the lower body. These two things are very much connected, so these go hand in hand together. But this is a separate video that's going to primarily focus on the upper half and how it relates to this natural asymmetrical pattern. We have a predisposition to lean over to this right side. So in order for us to not walk in a circle to the right or fall over to the right side, we need to do something about that. So unconsciously, what we like to do is rotate our trunk relatively to the left. And that's going to allow us to keep a more neutral center of mass, so to speak. Looking at it from the back side here, what we're going to see is a counter rotation back to the left, relatively speaking. So if we're high here and the sacrum is turned right, we're going to, around this T8 region, right about here, is we're going to have those vertebrae above that region start to rotate relatively to the left, which is going to allow us to get that even center of mass so we're not falling off to the right. As a result, these scapula are going to be in different positions. If I rotate this way, this right shoulder is going to drop, which brings my right scapula further away from my spine. This is internal rotation, abduction, and also relative amounts of upward rotation of the right scapula. The left scapula, therefore, is biased towards this position where the shoulder's higher, and that means that the scapula is going to be a little bit closer to the spine. That means that we're in external rotation, adduction, and downward rotation of this left scapula. So from a front view then, we're sort of here. And if you notice what that does to the rib cage, what you see is you have this compression of this side of the rib cage. Our diaphragm also plays into this. So we have this asymmetrical diaphragm, which is actually bigger on the right, but because we are in this position right here, the air from that diaphragm has a bias to go into the left chest wall, which opens this up. And that further facilitates expansion of the left side. And over time, if this is our breathing pattern, we are constantly feeding air into the left side, that's going to hold us in this position with the left shoulder higher. Because the right scap is further away from that spine right here, we have more ability to expand this right posterior rib cage. And then we're in this position where we're expanded here, more compressed here and unable to get as much air into the left posterior. And then the inverse is true for the front. So we're going to have an inability to expand this right chest wall and more of an ability to expand the left chest wall. Now, if we're stuck in this position over time, muscles are going to get tight that hold us in this position. So internal rotators on the right side, such as the lat, which attaches on the humerus and can pull it forward, is going to probably get a little bit tight over time. In addition to, we're going to have a little bit more tightness on the right side on the pec minor, which again can pull that shoulder forward and hold it forward. We're also going to have tighter right obliques, the internal obliques, which are responsible for pulling this rib cage down and keeping us in this side bent position on the right. On the left side, we're going to have more restricted or tight pec major, which is more of an external rotator. We also have, on the back side here, muscles that are going to be holding this scapula against the rib cage. So the rhomboids are going to be a little bit tighter on the left side. And down below, we're going to have more tighter or concentrically oriented low back extensors on the left side because this left side is more forward, which is going to create more of an arch in the left side. And if we have more of an arch in the left side, then that's going to result in us being a little bit more elevated on that side, but also that's going to compress this back rib cage area right here and further feed into that compression of the scapula against the posterior rib cage. How do we know that this is you? How do you confirm objectively that you are in a right BC pattern? There's a couple of simple tests we can use. The first one would be a restriction in right shoulder internal rotation. Because we are compressed within this side of our rib cage, this anterior front rib cage, this shoulder is being pulled forward, which restricts us from being able to access that internal rotation. You can imagine this on yourself if you were to bring your arm up to here, punch your shoulder forward, try to go down. It feels very restricted. But if you come back and pull that shoulder back a little bit and then go down, it feels much less restricted. And this is a similar concept as to what's going on. Conversely, we would also expect to have less left shoulder external rotation. And the reason for that would be if you bring your arm up here, pin your shoulder back as much as you can on that left side, try to rotate back. It doesn't feel very good, but then shake it out, start in a more neutral position, and then go back. It's much easier because you're not compressing that scapula against the spine and also the rib cage, and you're allowing for the motions that need to occur for you to go into that external rotation effectively. There's a saying I like to use, and that is, you can't get somewhere you're trying to go if you're already there. So with this right side, we're pulled forward into internal rotation. It's hard for us to get into more internal rotation. Same thing for the left side with shoulder external rotation. We're already in this position, and it's challenging for us to create the room within the shoulder socket to allow for that humerus to glide in the way it needs to for shoulder internal rotation or external rotation. Two more measurements you can use are shoulder flexion and trunk rotation. Shoulder flexion is a measurement of the ability for the scapula to go into progressive amounts of upward rotation and glide smoothly on the posterior rib cage. If you have a position of a scapula that doesn't allow for that movement away from the spine and that upward rotation, you're going to be limited in shoulder flexion. As you see here, as I go overhead, we need more and more upward rotation of that scapula. We need this to move away from the rib cage. So if we have compression back here, then this is going to be more limited. And that's why we see more of a limitation on the left side. Also, we will be limited in trunk rotation, more so to the right side, because think about how our rib cage and orientation of the spine above that mid-spine region is affecting this. If we're compensatorily rotated here, it's going to be hard for us to orient ourselves that way. So what we need to do to orient ourselves this way is expand our back left rib cage and also expand this right here. So that way we can get that turn. And the ability to expand and compress these regions of our rib cage plays into that a lot. If you line up with the expected limitations and asymmetries from side to side, then this is an indication that you're in this pattern, but not everyone needs to address this. Not everyone needs to be perfectly symmetrical. Some people can go their whole lives without having any issues as a result of being asymmetrical, whereas others can be a little bit asymmetrical and have lots of issues. It's very individual, but just know that this doesn't need to be fixed on everyone. However, if you do feel like you have some issues resulting from this, then we can do some things to help restore asymmetry in an effective manner. The first thing is that we can't forget about the pelvis down here. So please go check out the left AIC content if you haven't done that. In terms of the upper body, what we're going to focus on is the ability for us to first get the expansion at the rib cage that we want in order for us to restore variability within our breathing and the ability to turn from side to side. Because as we mentioned within the trunk rotation assessment, in order for us to rotate, we have to have the ability to expand and compress in certain regions. So on the back side here on the left, we want to create space between the left spine and also the left scapula. We want to shut off these low back extensors as well, relatively speaking. And we also want to, on the right side, expand this right chest wall. And we want the ability for, as we expand that right chest wall, to allow for the scapula to be pulled back a little bit more on the back rib cage. But that will naturally happen if I can expand here. That's going to naturally help push my right shoulder back. So if we can do these things, that's a really good start. And you'll know if you're effective at these things if your test measurements improve. Muscles that will help us achieve these positions and desired areas of expansion within the rib cage and also help hold us in this new founded position or more variability within our system. On the left side, it's going to be the obliques, specifically the internal obliques and also the transverse abs, because these are going to help create more of a posterior rotation of that pelvis, but it's also going to help us pull down on the left side between our rib cage and the top of our pelvis here. If we can do that and then breathe in air, which is a gas that follows the path of least resistance, is more likely to go into our rib cage. And depending on how we execute these exercises, we're going to get some expansion back here, and we can bias that. We're also going to want to facilitate on the right side some serratus anterior, which is responsible for protraction of the shoulder, reaching of the shoulder, which is going to allow us to get this scapula and also the humerus to actually stay on the rib cage, because in the back we have more of this wing scapula position where it's off the rib cage like so. The serratus anterior helps hold the scapula on the rib cage, and it's a scapular external rotator, so it's going to help pull this back. Even despite the fact that we are reaching with the right arm, that's where people tend to get confused. Because we're reaching with the right arm, we are facilitating the serratus to stay on the rib cage if we are doing it effectively, and I will show you how to do that. The other thing we want to think about on the right side is facilitating the low trap and tricep, which specifically the long head of the triceps attaches on this lateral border of the scap, and that's going to help rotate it downward. And also the low trap will facilitate in the ability for us to bring this scapula back as well. Here are a couple of exercises that go after those areas of expansion while facilitating the musculature we're going to be targeting to help us hold this new position we're going to be in. If you want more examples, I will link more down below in the article I'm writing alongside this. This is the all-four left posterior mediastinal expansion in left AFIR from Postural Restoration Institute. The purpose of this is to get the left hip to come back a little bit while getting some expansion more so in the left back rib cage and the right chest wall. So to set up for this, we want about a 2-inch book underneath the left knee or some sort of object. And we want our knees underneath our hips and our hands slightly underneath our shoulders here. And then we want to have the elbows slightly unlocked and the neck should be in a nice neutral position. A good way to know if you're in that position is if you can talk well. If you try to talk with your head down, doesn't feel very good. 2 up, doesn't feel very good either. So nice neutral cervical spine. Good. These shoulders are out of our ears. And with these elbows slightly unlocked, I want you to just slightly tuck there, Trevor. Good. And then push the floor away very gently. That should get these ribs back just a little bit. We don't want to go so far to the point where you're overly rounding like this. We want to keep the sternum up. This bone right here, if it was a laser pointer, it should stay directly down at the ground. So this looks pretty good. Now all I want you to do there, Trevor, is just exhale nice and gently through your mouth. You should get all that air out as if he's fogging a mirror. All the air out. You should feel the side abs engage on both sides. Hold that slight tension in the side abs as you inhale through the nose. And you should feel a little bit of expansion in his back and a tiny bit in his chest as well. This is the right side lying, right apical expansion with left arm reach and left adductor activity from Postural Restoration Institute. The purpose of this is to really open up the right side and expand it with air while getting some compression of the left side with the left oblique, but also the left adductor incorporated in hip extension as well. So to set up for this, we want to be in this Hemi 90-90 position, meaning that our left hip is in full extension in line with the left shoulder, hip, and knee. And the right leg is out in front at a 90-degree angle as well. So we really want to open up the right side here. So we want to start in a position where we've got the right arm pretty far out to the side here, so that way we can really lean into it here. And we should really feel this side opening here and this left side coming down and closing. And then what we want to do is reach with the left arm straight ahead. Good. Now what we want to do here on this left side is slightly push down into the floor with the left knee and sort of pull it in towards you, which should give you some left inner groin on that side. And then what we want to do is exhale through our mouth, pushing the right knee down into the floor too if you want, and that should give you some left oblique big time on this side as you finish that exhale. Maintain that as you inhale through your nose, and you should feel a big old stretch on this right side here in the right oblique and sort of the right lower rib cage right here. And then as you exhale again, try to reach that left arm just slightly further forward, and that should intensify the stretch on this right side. All the while, you're focusing on feeling that left adductor working in this hip extended position. Once we have an appropriate seat height where we have a 90-degree bend at both our knees and our hips, we want to roll back our pelvis until we feel both of our sit bones, or those bony protrusions in each butt cheek, or your ischial tuberosities. And then place your hand on your left side right there, those left low ribs, Trevor, and then I want you to exhale and side bend to the left. Good. That should engage those left outer abs, and you should also feel your left sit bone more than your right, but still keep your right one on that bench or chair, whatever you're using. And then, Trevor, I'll have you extend your right arm off to the side so he's got a little bit of a gap right here in between his humerus and also his trunk, and that should engage the muscles on his tricep, back of the arm, and then the lower right shoulder blade, which is his low trap. He's going to hold that position as he breathes in through his nose, out through his mouth. Upon exhaling more through the mouth, gentle exhale, he's going to feel those side abs engage even more. I want you to hold that compression in your side abs, Trevor, as you inhale through your nose, and that should give you some expansion in the chest on the lateral side right here and also right here on the right side. This is the standing supportive passive left AFIR with right trunk rotation drill. The purpose of this is to keep us in our hips secured and training the trunk to rotate independently from the lower body. To set up for this, we want to have something at about waist height. A table works, a box works, whatever is just firm and stable. And we want to have about a 1 to 2 inch surface underneath our stance side leg, which is our left side in this case. We want the whole foot flat. And we want to be about a foot, maybe a foot and a half away from this table or whatever you're using. So now what we want to do is bend both knees and get heavy on the left heel. We want to have 80% of our weight in our left heel, keeping the whole foot flat, and the other 20% of the weight is in this right arch where the right big toe here is, not the actual big toe, but right here, and the inner edge of the heel. With that 20% of his body weight, he's going to push into the floor with that right foot arch, which is going to push his right knee ahead of his left. And now I want you to tuck your hips and round your back a little bit, and then hinge slightly back, keeping the right knee going forward, and then you can place your forearm right here a little bit. Good. Now slightly side bend to the left, just a little bit. Very nice. Reach that right arm straight ahead and exhale gently through your mouth. Nice, fogging a glass exhale. He should feel his left side abs engage, making sure the left knee is going slightly in to get a little bit of left inner groin. Good. Now, as he goes into the next exhale, I want him to rotate his trunk with his arm just slightly. He's going to reach an end range pretty quickly, right there. And he should feel a ton of left obliques rotating him. No left low back. He's going to pause in that position, keeping his right knee going forward. As he inhales through his nose, he should feel all this right side expand. And then he's just going to rotate 1 inch more, 2 inches max. If we overdo it, we're going to end up rotating through the left low back. So just please don't overdo it. Go really slow. Inhale. Feel that right side expand. Exhale, go a little bit further, making sure you're staying in your left hip, feeling that left heel. Don't lose the left heel. Don't lose the right foot arch with the right knee going forward. To summarize, you can't really separate the upper from the lower body. So this is a right BC video, but just understand that the pelvis also needs to be addressed. The good news is with a lot of the exercises I just showed you, they are considering both of those things at the same time. But ultimately, you're going to know if you're getting better if your assessment results improve. And I would highly encourage you to think about these things working together in terms of the upper and lower body, rather than just trying to address an upper body because there's an upper body problem. We ultimately are so connected within our joints, our tissues, our fascia, all of these things that make us humans. So it's important to address and take into consideration all of these different factors.